This is Professor Ndubeze Okonkwo. I am a specialist in internal medicine as well as nephrology and hypertension. I am also a specialist and consultant in solid organ transplantation medicine. As a biochemist, my colleagues asked me to do this educational video on food and nutrition as they relate to the body and diseases. Today I'm going to focus on overweight, excessive fat, and how they can be modified in order to achieve good health. As you know, hypertension and diabetes are very common in adult population worldwide, particularly the African American communities, Africans on the continent of Africa, the Native Americans, and the rest of the world. The number one cause of kidney failure is diabetes. The second most common cause of kidney failure is hypertension. These two diseases contribute to majority of the illnesses and death, because number one cause of death in America is heart disease, and these two diseases contribute immensely to heart disease. So if you can modify them or control them, you will reduce all the complications they can cause, and as such prolong your life. This is related to overweight and what we call insulin resistance. If you remember in my previous video, I had mentioned that diabetes and hypertension are silent killers. If you take a look at most men, you probably will notice that the abdominal girth, which is the abdomen or the trunk of a man, usually when they grow from teenage age to full adult age, the abdomen will begin to protrude as a result of storage of fat around the abdomen, most of which come from what we eat and what we drink. When you drink alcohol, your body will convert a lot of the alcohol you drink and store the fat around your belly. And that's how men develop a big belly. In women, they probably store them in the gluteal area, which is the back of the women, as well as their abdomen also. Two most important things I want to talk about now is the food we eat that is going to help reduce these complications and prevent these diseases. Whenever you eat, our food consists of, if it's a balanced diet, mostly starch, protein, then we have vegetables, fruits, the minerals, all in the same food, and then fat. The fat I'm talking about is oil or oil-like substances in our food. So classifying them again, we can say starch, proteins, fat, minerals, water. The most troubling part of our food is the starch. Like the sugar on your table that you put in your coffee or your tea, most of the starch you eat, they are made up of sugar, just like the one you have on your table. When you build a brick wall, the basic unit of the wall is a brick. If you lay bricks one upon the other, after a while you have a wall. The same way starch is built from sugar. If you add one sugar to another as molecules, eventually they're going to form starch. So we call the sugar a monosaccharide. You don't need to remember what it means, just remember sugar. But if you take many monosaccharides or many sugars and join them together, they will become polysaccharides, or they're going to become carbohydrate, or they become starch. If you break the starch down after you eat, all of that will come back to sugar. And then the fibers that you use as a thread to hold them together to be polysaccharide or to be starch. Once the food is digested and becomes sugar, it's going to go into your body as sugar. And we make energy from these substances that we eat. Particularly, sugar is the easiest way to make energy. Therefore, that's the one the body wants to use because it's very efficient in energy production. So whenever you eat, let's take for instance, you eat a sandwich, which is bread and meat and some maybe tomato, lettuce, and we call that vegetable. When you chew this sandwich in your mouth, the breakdown of the starch begins in your mouth by an enzyme called amylase. You don't need to remember the name of the enzyme. Just remember that there's an enzyme in the mouth coming from your saliva that helps start breaking down your starch in your mouth before it gets to your stomach. When it gets to the stomach, there are enzymes there that will also help to break up the starch. At the end, the breakdown product is going to become sugar. Then it's sent down from your stomach to your small intestine. And then this whole ball of sugar will be absorbed straight into your blood. When the sugar gets into your blood, it's going to sit in your blood and can't go anywhere unless your body can produce insulin. Insulin is a hormone that is made in your pancreas. Okay, pancreas is an organ in your body. So if you have enough insulin, it's going to move this sugar from the blood and send it into the rest of your body cells where the energy production takes place. That's how we get the energy from the food we eat. But the sugar will not get into this area where the energy is produced unless insulin tells the wall that separates the blood vessel from these cells or these other organs where the sugar needs to go in for the energy to be produced. So when the insulin knocks on the wall of this department and say, I have enough sugar here in the blood, I need you to open up so I can send you sugar so you can make energy. They will open up and then sugar will go into the cell, which is this department. The cell then would attempt to convert the sugar into energy. And it has various mechanisms or various processes that make it happen. One is that it's going to take that sugar in a place we call the cytoplasm, which is the swimming pool of the cell. And that swimming pool contains other things we call organelles, different factories, one of which is called mitochondria, but there are others. Endoplasmic reticulum is one of them. Even the nucleus, where your gene and your DNA, where they are stored, is at the middle of the same cell. But we are going to focus on the energy producing organelle, which is a factory. That factory is called mitochondria. So when the sugar gets into the cell, first you arrive into the pool called the cytoplasm. This pool has many processes going on there, one of which is what we call endomorph pathway. another name we call it, is glycolysis, if we may use that. The sugar is then sent to a process where certain things will be attached to it, one of which is a phosphate. And then it's going to convert that sugar into other substrates or other entities. At the end of the day, the sugar is converted finally to what is called acetyl-CoA. You don't need to remember the name. That last substance is what goes into the factory called the mitochondrium, where energy is produced. And this energy is produced through a process called Krebs cycle. And then at the end of Krebs cycle, the energy-rich substance will go to some place we call cytochrome system, where energy is produced finally. And that energy is called ATP, adenosine triphosphate. Don't need to remember it, it's just energy. So if you remember this, it therefore means that if you do not have glucose in your blood, then you can produce energy from glucose. And the benefit of that is then that if you do not have this glucose coming from your sandwich, then your body is going to resort to get fat from wherever it's stored in your body, particularly the one around your abdomen, which we call visceral fat. There are three kinds of major fat as we store them. One is subcutaneous fat, the one you find on your skin. Then you have the visceral fat, the one we store all over our body. And then the one we call liver fat. But the most important one we're going to be dealing with right now is the visceral fat, which is the one you store around your abdomen and your buttocks and everywhere else. Your body would then go there and start breaking down this fat in order to produce energy. And you produce energy through a different process other than the one glucose travels through. As long as he's pulling up that fat and converting it to energy, then you'll start losing weight, because what you're losing is the fat weight. And this fat is primarily built from excess starch that you have eaten. When you have excess glucose in the body, the insulin knocks on the wall and say, open. The department that makes energy is going to say, no, I cannot open. I have enough glucose here. I don't need any more. And so your body would then have the glucose in your blood circulating around the clock. And that's how you develop diabetes, because you have too much sugar sitting in your blood. In some cases, even though, which is type 2 diabetes, even though you are able to make insulin, after your insulin keep bombarding your body, telling it to open up to send in glucose, they're going to get tired and say, no, we have enough glucose, we're not going to let you in. And so you have that pile up in your body, then that's how you develop diabetes. So if you don't want to have diabetes, then diabetes type 2, you need to make sure you do not eat excessive carbohydrate, which in turn will turn into sugar, which in turn is going to create what we call insulin surge, meaning your pancreas is going to be forced to produce insulin persistently. So it will be moving the sugar from your blood as you eat all the time. And then your muscles will get tired of listening to insulin, and they develop resistance. When insulin is knocking, they will just close their ears. They don't want to listen. Therefore, the door will not open, and then the glucose sits in the blood. And that's how diabetes starts. If you want to reverse the diabetes, and if you want to prevent the diabetes, the most important thing to do is do not gain excess weight. It doesn't mean that somebody who is thin does not have diabetes, but I'm just discussing the relationship between this and excess weight and how to reverse it, meaning how to cure it, which means you have to avoid excessive starch. And the quickest way to do this is to do what is called fasting. And what is fasting? It doesn't, when you hear fasting, people think about spiritual things, or meaning don't eat at all. No. It means that you're going to take your 24 hours and break it into 2 to start with, 12 and 12. So you do 12 hours of eating and 12 hours of not eating. So when you are in your 12 hours of not eating, the only thing you put in your mouth is water. Anything outside of that should not go into your mouth. But you have 12 hours of eating, you're going to eat a balanced diet. And so if you are starting this program for the first 2 or 3 weeks, do the best you can to remove starch completely from your food and eat the rest of the food you have. You can eat meat, vegetable, fruits, nuts. If you do so, your body is going to be devoid of glucose. And when it happens within the first 12 hours, your body is going to go to where you store glucose in your liver and in your muscle and pull the sugar from there and your muscle and put it in the blood and use it. After that, they have no sugar anywhere to pull from. Then your body will start breaking down fat. And if you do so in 2 to 3 weeks, you're going to notice sudden drop in your weight, approximately 10 pounds. As long as when you eat in your 12 hours, you don't eat when you're not hungry, and you don't eat what you're not supposed to eat. If you remove carbohydrates from your food the first 2 to 3 weeks and do the 12-hour fast and 12 hours of eating, you will lose weight, most likely around 10 pounds. And then if you continue that, you're going to keep losing weight. Eventually, your goal is to get to your ideal body weight. Once you start losing this weight and not using carbohydrate, your insulin production or surge to your blood is going to decrease tremendously. And that will begin to cure your insulin sensitivity. Meaning, if at all your insulin rises when you eat, it's going to be appropriate amount in rise, and your other parts of your body will respond to knocking on the wall. They will open up and the sugar will come in. So this is a way to deal with diabetes and also to deal with weight control. This same insulin resistance may be responsible for all other things that happen to us, because a cancer cell may not grow if you deprive it of energy. The growth factor that causes it to keep multiplying is not going to be stimulated. So it's going to minimize the chance of having cancer. And at the same time, when you begin to deprive the cells unnecessary glucose, the cell gets well because they're going to be producing what is called ketones. These ketones are going to make you even brighter. Yeah, you think clearly, you're going to feel better, your energy surge will rise, and above all is that all your other organelles in your cells that are aging, they will help to get rid of them. It's going to make your body become younger, even though you look older outside. But if you're looking older inside and look younger outside, that is progression to death. So this simple method of fasting, you can start with 12 hours of fasting and 12 hours of eating. Some people will choose 6 to 6, others 7 to 7, 8 to 8, 9 to 9. It's easier for most people to do their fast at night, meaning if you, after 8 o'clock at night, if you choose 8 to 8, you don't eat after 8 o'clock at night until 8 the next morning. That's complete 12 hours of no food. And in these 12 hours of no food, you don't have insulin surge because there's no glucose there to force your pancreas to produce more insulin. Then when you eat in the morning from 8 to 8, then you eat only when you're hungry, and then you eat food that is devoid of carbohydrate or starch in your first 2 to 3 weeks. And after that, you can come back and then add your starch to your food if you want to, because you need it. When you add it, you're only going to add approximately 25% of your meal will be starch, and it's going to be complex carbohydrate starch. Not any of this processed food they sell in the store, such as biscuit, rice, spaghetti, that they are processed. If you want real starch that come from, you get your food from the soil or from the tree. It's the simplest way to eat complex carbohydrate. Get your food from the soil or from the tree. If you get yam tuber, cassava tuber, potato, those things are coming from the soil and they are complex carbohydrate. But if you go and get mashed potato, it has already processed, the fiber probably removed. When it gets into your body, it is quickly converted into sugar and then it will surge into your blood. So when you come back to add your carbohydrate to your food, try to use complex carbohydrate. And then another trick is that if you want to eat this your complex carbohydrate, if you want to make your carbohydrate even more complex, when you boil your carbohydrate to eat, you can do it 2 days or 3 days in advance. If I'm going to eat rice on Wednesday, I'll boil my rice on Monday and store the rice in the fridge. When I store the rice in the fridge and bring it out and reheat it again, I am making that starch even more complex, making it even more difficult to break down into sugar. So when I eat that rice, the amount that's going to be converted into sugar and be transported into my blood will be less, because most of it will then transit out into the large colon and go out of the body as waste products. So this simple technique not only will help you lose weight and bring you to an ideal body weight, and as you know that weight is related to almost all diseases, it will also help you to minimize or prevent the complications that come from diabetes and hypertension, or prevent you from developing hypertension or diabetes, or controlling it to a level where you don't need medication anymore, which means your body becomes your medication. And this is the simplest way of minimizing the burden of taking too many medications. Some people I know take up to 20 medications. And if I tell you that one medication alone can cost $1,000, Eliquis, for instance, which is a blood thinner, is $800 a month. Certain blood sugar diabetes pill that can be used for kidney failure and can be used for the heart is $1,000 a pill, a month. Eliquis, as I said, which is a blood thinner, is $800 a month. If you have to take 20 medicines and you have 5 of them that cost up to $1,000 a month, you'll be spending almost $7,000 or more a month just for pills alone. Some of these things you can prevent them from coming, and the ones that are already here, you can reverse them back to where you may not need any medicine to control them. But when the complications start, you can minimize the complications by doing this same thing. So it is very beneficial to, if you have hypertension, you have diabetes, to take your healthcare with this approach of, in addition to all that you are doing, is do this process of managing your food. What you eat is what you are. You control what you eat, your body will change. And then I also know that when you are eating your food, to minimize your food from quickly being broken down to sugar, you can use apple cider vinegar, like teaspoons of that, and swish your mouth and swallow it 30 minutes before you eat your food. How does it benefit you? That amylase that your saliva produces, this apple cider vinegar will neutralize it. And then your digestion or the breakdown of food does not start in your mouth. If it does, it's just a little bit of it before it gets to the stomach. You can also use lemon juice, a teaspoon of that, swish and swallow before you eat. It will add to the process of minimizing the amount of sugar that come from your food from the breakdown. This is a public service. This is not a substitute for the care you receive from your doctor. So if you want to do any of this, if you want to, I'm advising you to discuss that with your doctor and make the decision that's appropriate for you. Again, in summary, weight reduction helps decrease the complications of diabetes, hypertension, arthritis, all other illnesses that are related to weight, and there are many. It will also help you in avoiding the complications or preventing complications that have started already. And if you don't remember that diabetes is number one cause of blindness. Diabetes is number one cause of losing your legs. Diabetes is number one cause of losing your kidneys. Diabetes is one of the 5 most common causes of heart attack. Diabetes and hypertension are interwoven. When both of them are mixed together, it's like Russian roulette. Both of them are known to be major players in causing stroke, kidney failure, heart attack, and other organ failures. And then your liver, which is the detoxifying factory. It takes things you eat and change them to where it's no longer a poison to you, and the kidney will take them and filter them out. If you replace the liver with fatty tissues, then you don't have enough liver tissues to take away the poison that is present in the food that you eat or the things that you drink. Those things would then begin to cause you different kinds of diseases. When you do this fast also, it's going to go to the liver fat and begin to remove them. And so when you do the CAT scan on most people these days, particularly those who are overweight, they already have fatty liver. And so it is very important for us to appreciate this information. And if you have any question, you can ask your physician and then refer to medical and clinical journals as references. I hope this helps.